Hey, so here we are back again. Thanks for joining. I have one question. I had a couple of comments earlier, but they're just kind of redundant. But yeah, to answer your question here, yeah, here's the total death count so far: 24, 631. Massive jumps in numbers, really, but we really can't um take these numbers into consideration, and we know that now. The World Health Organization has come out and said that the healthcare systems are stressed, and in not so many words, basically saying they're not getting the information that they need out of there, and because it's a disaster, and you could imagine um the whole situation in there developing and being in there, like everything's gonna not be business as usual for sure. It's gonna be a whole different atmosphere. um but we can look at the charts, and we can look at these graphs. These visual representations are, like, we can look at this and say, okay, wow, like that says more than numbers, right? Like, this is effectively all of China. It's spreading now elsewhere. US has confirmed its, I think, 12th or 13th case now. Just one sec here. But they're confirming cases all the time, right? US is 11, but that hasn't been updated. I think there is, yeah, it must be 12 by now. Yeah, their 12th case. Um, yeah, I was just reading that a few minutes ago. But yeah, we'll go right into that news, I guess. See if I can find that here for us. Uh, the updates. Yeah, so US planning several more flights from Wuhan this week. The Canadian government said, find commercial means out just recently. They're not making any more trips. The Canadian government has decided they're not going to be making any more trips. Um, the US says they're going to plan whether delays evacuation from Canadians from Wuhan. Yeah, and the biggest, most jumping cases in a single day were reported 24 hours ago. But that was also true for really the last three days in a row. Um, yes, it has been the biggest in the last of the 3 days, but the 3 days going back, yeah, they were the biggest ones yet. And you can expect that because they have a new method of testing now, and it's supposed to be quicker. But yeah, let's see if we can find that US case. But anyways, there is like 12 or 13, and the data just keeps rolling out. But it's not accurate, and we know that. But like, we got this cruise ship quarantined, and Taiwan and Hong Kong have officially closed their borders. They used to have like a bridge open there yesterday, and I think they had a couple of flights going in and out, but now that has completely stopped. All the workers in Hong Kong, all the medical staff, they're on strike. And with, like, everybody's kind of scared of this there. Like every other, it's not just Wuhan that's shut down. Like Shanghai, Shenzhou, there's 5 or 6 cities, like big cities, and they're just ghost towns. Um, Now we don't know the numbers. We don't. We don't. All we're seeing is images coming out of there, right? We don't know anything. Like, the infected could be in their houses or in their wherever, in their places of residence, and they could be sick, or they could be dying or dead. And we would never be able to confirm that because there's no, the health systems there are just swamped. They really are. You got to think, like, they were swamped weeks ago. They really were. I seen it happening, unfolding weeks ago, and I knew, like, even especially like Wuhan was the first one hit, but it just went wildfire. Like they just couldn't handle it. It would break any healthcare system. Like you just can't handle that influx of patients, and they are turning people away. They really are. Now they have this. I don't know. You gotta get a certificate. You gotta apply for a certificate to get an appointment, but then then you can go to the hospital with the certificate. But then, if they can't admit you to the hospital, and they can't because they have no inpatient room at all, you can't get the test done. You have to be an inpatient to get this test done, kind of thing. But they just don't have the room. So the people are getting turned away, and people are realizing that, and they're not even going out anymore to go to the hospitals and go to these places. And you got to think, like, they are a very they've had really bad experiences in the past with things, and this is even worse, way worse. It's never closed a city. It's never done anything to this measure. The coronavirus broke out, I think, a couple of times, and there is reports on that, like actual mainstream media and government reports that say that it leaked out of and they got control of it, but it didn't catch the mainstream attention. It didn't catch the attention of the world. It was kind of just a little local thing, and nobody really paid much attention to it. But this here is, there's cruise ship, and there's 10 people infected on this cruise ship. Of the 274 tests that were done preliminary, the first ones, when the health officials realized that there was a possible case on there because this person, had traveled to the area, well, then they went and tested him and 30 other people. And out of those first tests that came back, out of the 274, a third of them were positive. So you could imagine. And you got to think that this cruise line as well, it's this isn't the exact one, but actually this one here, and they're off the coast of Japan, but it's a very luxurious cruise line, top of the line, right? It's actually immaculate, and it's for the older demographic. Really, it's aimed at retirees and seniors. So we got a ship here full of people probably with a ton of underlying issues, and and it's the first preliminary test come back, and a third of the people are positive. It would spread through there like wildfire for sure. We don't know much about this. Scientists say they don't know. The World Health Organization did another update today, and they said, we still have limited data on where this came from. And when they were asked about the question about whether China covered this up and was suppressing the deaths while there was meetings, international meetings going on in Wuhan, they were covering this up. And yeah, so it was a a statement that you can take either way. His answer was, well, we can't confirm it nor deny it at this point, right? But if they can't come out and say, well, yes, 100%, they can't say, well, yeah, China did it, or they suppressed it, right? Because they don't have actual 100% data-driven evidence to come out and say that. But you know what I mean? Like you can see, like, the doctors, like, he tried to alert everyone. Dr. Lee, he's up in the left-hand corner there. They arrested him and his 7 colleagues for trying to bring attention to this. You know what I mean? Police wouldn't go in and arrest the doctors unless there was like some high up authority governing this to say to go in and do that. These guys had a chat amongst professionals online, and within hours they were arrested, and they had to sign documents stating that they wouldn't.
That?
And this
Lee
is from
answered,
CNN.
yes, I can.
In the weeks that followed, the Wuhan Municipal Health Commission maintained that there was no obvious evidence for human-to-human transmission, no infection of healthcare workers, and that the outbreak was, in their words, preventable and controllable. And with that, the people of Wuhan continued about their normal lives. Then came a sudden jump in infections. China's central government took over, scrambling to contain a spreading virus with a rising death toll. Chinese state media first reported that Li was one of several whistleblowers silenced by police. Calls for Li and the others to be vindicated grew online. China's Supreme Court even weighed in, adding, quote, "It might have been a fortunate thing if the public had listened to this rumor at the time." But for many, including Li and his parents, it was too late. They all contracted the coronavirus. Li is now fighting for his life, alone in quarantine, but online, considered a hero. Tens of thousands praising his attempts to sound the alarm, ahead of what's become a global health emergency. After the Chinese Supreme Court made those comments in support of Li and the other whistleblowers, we did hear from Wuhan police. They released a statement essentially saying, look, the whistleblowers weren't fined and they weren't detained. They were simply questioned and let go. Now, we did also reach out, CNN did, to Wuhan police as well as the local health commission. Allison, they declined to comment.
Like, you know what I mean? It is just a massive shit show happening right now. All the red flags are there. I was watching this from day one, when, like, before the lockdowns. But I knew there was something kind of off this time, you know, but I didn't know if it was maybe just Chinese Communist Party trying to, you know, get back at the Hong Kong rioters, or, you know, who knows, right? Like, it's a weird governed country in there. So, yeah, I had a lot of speculations on this, and they're starting to be validated, unfortunately. It's not fear mongering, it's of any kind. It's just being real. There's alarmists and then there's realists. You know, alarmists have absolutely no data to back up their theories usually, but there's a ton of supporting data to back up, you know, the theory that this is a biblical proportion event. If you, however you want to put it, you know, a global catastrophe. It is, and the markets, you know, Japan, or I shouldn't say Japan, China, dumped in $174 billion with a B in one day, just to keep everything kind of in the green, because they took a massive slope. I have past videos with them, and Shanghai, China, they dropped 7%, which is unheard of, really. But they liquidated the assets of their central bank. They seized the central bank, I guess, and in China, and liquidated their assets. So, like, basically they pawned everything off, and then they dumped this big amount of money into the system, and it makes the markets look like everything is performing right now, because, you know, there's such a big influx, and it's only a matter of time before that dies out. You know, there's no more investing really going on in there, because nothing's operational. We got the factories and everything shutting down. Apple has pulled out all of their production services out of there, like everything. There was actually numerous big companies in the news and CNN pulling out, right? And they have to, right? They can't stop. They have to go to another country or build a factory or whatever they got to do to continue on, right? It's going to affect everybody, and I think the worst of it is you know, we're stalling on this data analysis, trying to find, you know, more data. You know, we don't know really what this is. They haven't seen really a lot of firsthand stuff out of China. You know what I mean? I'm sure they have actually, but you know, they're not disclosing, like, the gravity of the situation, because they don't have any concrete data to go on, and that's kind of like their wheelhouse right now. It's like kind of like their little protective shell, in a sense, that gives them space that they can say, okay, well, you know, we're still waiting on data, we're still waiting, you know, and they're just buying time, but we can't buy time with this. I know the gravity of the situation. I understand viruses, you know, since the last 2 weeks I've been doing this, and I know that sounds like very limited knowledge, but, you know, this thing is ridiculously aggressive, and we know that. We can just look at China and say, hey, there's millions, like, there's tens of millions of people in these cities, and they are ghost towns. You think about that. if what drove, what let the fear to drive all those people in, like they seen something, right? They know there's something off. So, and it's not all like Wuhan was, like they quarantined stuff off. But once people realized like what was going on, they tried to gather supplies as fast as they could. But once people got inside, they weren't going back out really, unless like absolute emergency. You wouldn't risk getting infected. You would stay inside. I'm sure they've seen some pretty ugly sights. Like there was, and people are dying from it, and they just couldn't handle it, and that'd be a pandemonium down there. And we've seen the videos coming in there; they're absolutely horrific. And like that's some of the ones that got out before the lockdown. Before that place went dark, there was stuff that came out. And it was being speculated as rumors and false, and because it was just coming out, and people were like, oh, that's fake, blah blah, Russian hackers or whatever. But I was looking at these videos and I was watching them, and as hard as it was to watch them, I was like, this is genuine. Like, I'm looking at this and like, reviewing them and going, well, as you could ever, want something to be authentic, I firmly believe that, just with the, the demeanor and the actions in the background and everything just lined up with the current events, and you can kind of tell if something's a little wacky or kind of 50-50 or very plausible and authentic, right? So I think it looks good, right? That's all you can ask for, and that's all we have to go on, because there's no data coming in from any. World Health Organization still says they don't know anything about it. They say, well, yes, we know it's transmitting locally in more and more countries. We know that smaller countries are going to get hit hardest, with this weaker health cares. Of course they would, like they don't have the capacity to deal with that kind of a thing. And all the resources are being thrown at China right now, to try and help China out. But like, is it too far gone for China? Like, that's a question we have to be asking, because it sure seems like this thing is just wildfire. And if like, it really does. It almost seems like that's it's it. Or unfortunately, unless they can come out with a cure, right? Unless they come out with a cure but you would need time to develop this even, and you got news stations like I seen one. It was CNBC, and I was like, what the hell is this guy going on about? And he was, and the title of the story, or the headline was, China finds China. This is what it said. China finds a cure for coronavirus. That's what it said. And I just watched the World Health Organization like 2-3 hours before that saying, there's nothing actually in the works right now. There is possible candidates, but they're not ready to go to human trials, and blah 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 blah. So just nothing, right? And then you got this newscast going like 2 hours later out of, I think it was the UK, and I was like, wow, this guy's just gonna look like a dummy. I was like claiming that China had a cure, but you know what I mean? I knew what was going on. I read the other report earlier, and what it was is that they have this HIV medicine, which kind of is curbing the symptoms and controlling it. It's bringing the fever down. It's kind of neutralizing. It's therapeutic. It's not a cure in any sense, and it's not going to stop it or slow it. It's just like it's just it's like ice on a sprained ankle or something, right? It's just superficial kind of thing. It's not really going to help, but it's it's not really going to help fight off the virus, but it's going to help with just I guess the effects might improve their condition a little bit, but they still don't know anything about it. And then you got so much news coming from every different source, like everywhere somebody's got a different story to say. But if you go to the actual source, and that's the World Health Organization, and you follow up on their news releases and their press releases, and still say they have no idea, but they say that it is very volatile. They said that it is very hard to detect. They said that they have, there's cases of people definitely now passing it on without showing symptoms. They have confirmed that. Before they were like, well, there is reports, but we still need more data. But they have confirmed that now, that it's transmitting in other countries, and Canada was one of them. Canada was the latest one we got, was in British Columbia, and it was from a family member who contracted it from a person that was there. So, and and we know that it is definitely spreading, and we know that. But it's always evolving, right? It is always evolving. And like 10 passengers quarantined on the cruise ship. That cruise ship's I'm sorry, but you know what I mean? That's they the world's gonna watch this right now. I don't want to make too much speculations, but I have a good idea that that's unfortunately that's the worst situation, and they got them quarantined out there for 2 weeks. 14 days. They're gonna keep them on this cruise ship. I don't know. We don't know what this is at all. And you have these people holding up a tarp, so like people can't take pictures or what have you or whatever. I don't know, but they're only like wearing like masks. They don't seem, they don't seem to be in the proper attire. We don't know what this is or how it's spreading or nothing. They could be possibly affected just by opening up that door. It could have, just little bits on them, and we don't know how anything about it. But yeah, we're treating this like something like past outbreaks, and I guess that's all we can do. They're using this as a statistical situation, and everything is based on numbers right now, and past outbreaks, right? And they're like, well, we need to get more scientific data. We need to get more, and it's gonna be a lot, right? And the U.S., yeah, like the U.S. claiming more now, and it's just gonna keep growing, right? It will. Wisconsin has case of new coronavirus from China, and the person, like, well, they're saying that they did fly from there and they were at home and whatever. But whatever. Make me do a survey before I can read your paper. 2 more patients being tested for coronavirus in New York City. Yeah. ABC 7, so New York. 2 more people are being tested for coronavirus in New York City, officials said Wednesday, bringing the number of people whose samples have been sent to 5. So New York alone has sent 5 samples away. So if they're, what I mean, like, these guys are going through vetting things, and they're just not going to take samples from somebody that's just like, oh well, I got a fever. Like, they have to have been in contact with somebody from there or have been there. So and if they're showing these symptoms, it's almost, what I mean, it's just gonna explode. And how many people are going to the hospital? Like, how many people are just staying home and being like, well, I'm sick or whatever, I'll just stay home, but they have it. You don't know, and it's gonna fall apart at the arse really quick. You can guarantee it. If they don't get a handle on this, and it's just spreading, and now this cruise ship, they know something about this, but they still need to do more tests and more studies and waste more time, kind of thing. In my opinion, it's just it's a disaster. Like, but who knows, right? They got to base this on actual facts, and he said that in meeting, right? He said, not time for speculation or rumors, even though there might be like a very good reason to speculate, and a lot of The rumors are, you know, wow. So, you know what happened with the rumors in China, right? The rumors turned out to be true. That the place was falling apart. And the doctors tried to warn people. And then they arrested the doctors, right? This is on CNN. You know what I mean? It's crazy what they did to these people. You know, they tried to alert the world and say, hey, look what's going on here. And
he agreed to sign this document,
them,
admitting to spreading rumors online and severely disrupting social order. It reads, "We want you to cooperate with the police and listen to our reminder and stop the illegal act. Can you do that?" Lee answered, "Yes, I can."
In the weeks that followed, the Wuhan Municipal Health Commission maintained that there was no obvious evidence for human-to-human transmission, no infection of healthcare workers, and that the outbreak was, in their words, preventable and controllable.
Oh, yeah, whatever. But you know what I mean? They hid it. They hid it because they arrested the fucking doctors who tried to bring it to attention. They tried to, everybody's screaming, all these, you got a fucking epidemic, like people from Harvard, there's, and they're saying stuff, right? But they can't come out and make direct assumptions either. But they're like, look, this is not right. And it's got all the scientists everywhere baffled. They're saying, oh, well, we can base this off, past outbreaks, and I guess that's all they got to go on. But this is nothing like past outbreaks. We know that now, or knew that for a while. But they can't make any assumptions or concrete decisions until they start getting the data in. And I think that's going to be, the downfall majority, because it's still, time is ticking away, and this thing is continuing to spread. It makes. It makes sense that they want to have scientific data to back their decisions, but what about just actual fucking common sense? You know what I mean? I don't know. And we got a cruise ship, got the cruise ship that's quarantined, and we haven't really received any more data or any more information on this yet, as just what, the most disturbing information, really. They did 273 tests because one person aboard had been to the area where the infection started. So they traced down this one person, they tested him, and they took a bunch of other samples just in case. And then the first 31 samples to come back, there was 10 people that tested positive. And it just random testing. The first 31 tested, a third of them tested positive. And now people saying, they're bringing the age into it. Well, age really doesn't have a lot to do with this situation. It's going to affect everybody equally on here because it's a very high class cruise line. Where it's aimed at retirees and the elderly, and it's super high class. So you can definitely bet that it's pretty good living in there right now. But at the same time, it would be quite disturbing, and to see these people coming aboard, boarding your ship in suits, and who knows, I think they know what's going on, that there's people on there, and that they're infected, and the results should be very soon for these next tests, if not more rolling out. And you can only guarantee that more people are going to be infected on this ship for sure. And it's quarantined for 2 weeks. They're not allowing anybody to come off. They're only taking the most severe cases off, and they're taking them to the ICUs. But that's only going to cramp the healthcare system there, because this is in Hong Kong, off Japan, so. It's a lot, right? Well, Tokyo, I guess. It's real. Of the 31 people who have been tested, 10 cases tested positive for the virus. Of the first 31 that came back out of the 200 and some tests that they did. So that's not good numbers at all. And I'm sure they're probably testing everyone on board at this point. Um, yeah, so it's crazy, right? And the news is saying, well, there's nothing really to worry about, but we don't know anything about it. Um, but don't worry, everything is just shitting the bed right now. And it's not like Ebola, it's not like SARS, it's not like MERS, it's like nothing like that. It really isn't. And there's a lot of speculation going around, even in the scientific community, there really is, about the fact that this is, something that could have got out of containment. Let's just say it, right? It is, and everybody's like, well, it's just a conspiracy theory, and yes, it's not confirmed at all, but neither is it, confirmed by the World Health Organization that Japan covered this up. They're not saying that, but here you have 100% proof, like that, like CNN talked to this doctor on his deathbed. He was he was the guy who tried to alert everybody, right? And in a final stand, he gets a hold of CNN and sends, and sends like the copies of everything. All the stuff says, he was arrested and him and his doctors were arrested. And it's not just him saying this. Like the whole healthcare community at the hospital seen the doctors being arrested and detained, and, all their students, like some of these doctors are teachers too. They just went in and arrested them. So it was a big thing, right? It was like, the hell, everything's kind of blowing up here. And, I knew this a while ago. This isn't something that just came out. This is like 3 or 4 weeks old. This is like when this happened. Let's go back to the timeline provided by Wiki. Fantastic. They're doing a good job at keeping this up. But, even Wiki reports, here on December 30th, Dr. Li, the ophthalmologist in Wuhan, China, posted a warning to doctors via his medical school class via a WeChat online forum. And then in the WeChat forum, Li posted that cluster of patients appeared to be infected by something similar to SARS. And Li, and said that they weren't responding to traditional treatments, so they were moved to the ICU. And later that evening, 8 doctors engaging in this WeChat forum were arrested by Wuhan police and charged with illegal acts of fabricating, spreading rumors, and disrupting social order. That was on December 30th. Right? And you know what I mean? Like, it was way bad in November. It was bad in November here. But it didn't really start rearing its head publicly until about, December 30th, when they alerted the World Health Organization, and that kind of got my attention. And I thought there was something different about this, and followed it like relentlessly, because there's something, and it's big, and you can guarantee it's big, and all the signs are there, and it's not like it is speculation, but it's not like a conspiracy theory. That it's conspiracy theories, are a little bit more far-fetched in my opinion. But when you have the evidence there, and we know the numbers are completely skewed, it's a logistical disaster at every lab to try to get these tests done, and especially in China, where these guys tried to suppress it, and we're going to take their information. Like, there's no oversight on these numbers. It's just whatever China wants to put up here. And now you have a case of, let's see, 1,029 recovered. That is so deceptive. Please do not think that that's cured, because it is not 100%. And all of these are out of China. Now, wait, I think there's 2 in Australia. Just wait. But these are all China. Just wait. I think there is 2 Australians, and I think there might be 1 in Japan. Yeah, South Wales, Australia. It's the only 2. There's only 2 people outside of China that have recovered, but officially on this list. But they haven't recovered in a sense that they're cured or they don't have the disease. And who knows? It's just China putting whatever. But people have shown signs of improvement, who tested positive for this, and they sent them home because they need that space, obviously, for more crucial or critical patients, for sure. Now, that was a case in Ontario, Canada. The person tested positive, and then, they were kind of ill when they arrived, so they went into ICU, and then they got better and went home. And also, his wife is at home, quarantined at the time, and she's positive as well, so they're both positive at home, quarantined in Ontario. And the fourth case of the Ontario, it was a 20-year-old woman who first initially tested negative upon a flight back from Wuhan, returning to Canada, and she tested negative. She went back to her daily activities, and I guess 36 hours later, she started feeling ill, went to the hospital, and tested positive. So, you know what I mean? I can see it right through. I see through the holes, and I think everybody is, well, they don't want to bring panic to the people, but what are you going to do? Just let this burn out? I know they're waiting for scientific data, but are you waiting and it's going to be too late? Regardless of whatever caused the time to elapse in China, whether they did suppress it and they tried to cover it up or whatever, it was still time wasted. I got something here I want to queue up for you. I'm going to take a 5, but listen to this and read what they hear here. If this is about data and people not given the proper data, even around the world, not just China but other countries as well. So it's scary. These guys can't even make a proper model because the data's not even coming in. Yes, buddy. Okay, yeah, fine. Yeah, check this out and I'll be right back.
Yes. Good afternoon. John Zarakostas for France 24 and The Lancet. Dr. Tedros, you just mentioned that one of the agreements in Beijing was the sharing of the data. Can you shed some light how much of the confirmed Chinese cases you've received the data in Geneva and in regional offices? Yesterday you read the Riot Act that many developed countries, less than 40%, had provided the data. What is the situation with the Chinese data? What percentage has been received? The reason I'm saying that, there was a classified briefing yesterday in Washington, and the most senior senator in the US Senate basically raised concerns about the reliability of the Chinese data. So if you could put that to rest. Thank you.
Thanks, John. You are correct in terms of the number of countries currently of the 24 who we've received comprehensive data from is improving, but it's certainly not complete. And the Director General spoke with the Ministers of Health of all of those countries and actually sent a circular to every Minister of Health in the world, specifically reminding them of the responsibilities to share this data on a regular, if not daily, basis. We also, the DG also asked not only for the sharing of the surveillance data cases, confirmed cases, but for the results of the community studies and other transmission studies that were being carried out, so we can collate all of those together. And we've been looking at a lot of that data that's been received so far. The Chinese authorities continue to share with us daily numbers. They also continue to share with us, as they did at the EC, detailed epidemiologic descriptions and clinical descriptions of the cases, including epidemic curves. The issues they face in the last week with the growing number of cases is sharing detailed and translated individual case forms. You can imagine the challenge for country X that has 12 cases are very different to a country that has reported 4,000 cases yesterday. So I think we need to leave a little bit of leeway and room here. This is a challenge, and we're very careful that we don't want to overtax the system, but at the same time get the information we need. We're certainly pleased with the clinical information. We're getting very detailed information on the clinical experience. We're getting very detailed information on the work being done in the lab. As you've seen, they've shared the country continues to share sequences on open platforms. So overall, we're pleased. We would, though, obviously like to have as up-to-date information as possible, but we say that to all member states. We say that now to every member state that has cases, including China, that we would like daily disaggregated data from them. And this is not so WHO has data. That is not the point. The point is that the world has the evidence it needs to make good decisions in the coming days and weeks. And within the strategic response plan, there's an element of that's around that global coordination function, and you'll see how that's costed out. But you'll also see in the strategic response plan that the vast majority of that investment is actually targeted at countries so they can build their capacity to detect, assess, contain, treat cases and report those cases at the global level. So if you point yourselves to that plan, the core of that plan is about improving our collective capacity to detect, prepare and respond to this event.
Thank you very much. The answers were quite long, which is good, but we will have to leave soon, so we have time for 2 more questions, and I think it's fair that we give one question.
We love the internet, but the internet is tracking everything you do. Take control of your online privacy with IPVanish. People with malicious intent are everywhere, watching you. Criminals can hack your Wi-Fi, while broadband providers and advertisers monitor your data. With IPVanish on your device, your internet...
Yeah, sorry about that. I kind of drifted off there. Okay, so, but you know what I mean? Like, the data's not coming in. We're not getting it, right? So the numbers are skewed at every point you could possibly skew them. But what we're gonna get from this here situation with the cruise ship, they are gonna get vital data from that. It's gonna be a good way for them to judge the severity of this. You know, they will be able to figure out how quick it spreads, or how a lot of information they can gather from that. You know what I mean, and apply it to a large scale. It's an unfortunate situation, but it's you got to find a silver lining situation, especially now more than ever. Really do. But anyways, I'm gonna take a 5-minute. I'm gonna have a coffee. Everybody else kind of do the same. Come back and check this out. You got questions, ask if you got. You know what I mean. I'm pretty up to date on things that are going on for actual facts and speculatory facts. Or I shouldn't say speculatory facts, but speculative theories. So yeah, well, we're just gonna take a little break here for a few. I'm gonna check the latest and go over everything. That's kind of disgusting. What the hell is that? Ew, so fucking disturbing. Alright, but anyways, yeah, there's more disturbing things going on right now, of course, in the world. So yeah, I'll be back in 5. Thanks for sticking around. Share if you care. Appreciate it. Hey everybody, if you're still here, my apologies for the wait. I'm just gonna be right back here. Appreciate sticking around. Gonna get right back at this momentarily. Welcome. I am back now. Yeah. Anyways, it is what it is.
Daddy. Why?
I don't know if that's going to be any better coming through there. Just trying to adjust the volume. Make sure it's not cutting in there. I'm having a problem with my noise gate sometimes. Problem with my noise gate. Yeah, I'm just gonna check if that's any better. Check 1 2, check 1 2. I know there was a little bit of background noise coming through there now. Yeah, my apologies. I'm just gonna check if that's any better. Check 1 2, check 1 2. There was background noise coming through there. My apologies. I'm just gonna check if that's any better. Check 1 2, check 1 2. I'm hearing my feedback on the voice. Yeah, I might start another stream. I don't know. Anyways, it is technical difficulties and it does happen. So. I'm hearing my feedback on the voice. Yeah, I might start another stream. I don't know. Anyways, it is technical difficulties and it does happen. So I'm gonna see if I bump up the noise suppressor a little bit, get rid of some of that background noise. Yeah, I might start another stream. Yeah, I'll go with that, but I'm gonna roll this stream. I'm gonna end it and just start up another one here right away, maybe. Check 1 2, check. Doing a sound check here. I'm gonna get right back into this. I'm having issues with it. I am having issues. Bear with me. Check 1 2, check. Doing a sound check here. Yeah, that's a lot better. Okay, cool. We'll roll with that. So, anyways, yeah, it's always we're waiting on more information from this cruise ship, or I am anyways, to find out, but we know that the numbers that came in the first time are pretty bad. Like, that's not good. Out of 31 tests, 10 people came back positive, and they're quarantined down there. Like, that's luxury cruise ship, and they are older demographic. It's aimed at retirees kind of thing. So yeah, I don't know. Let's just check some local or some latest news. The coronavirus. I'm having a terrible time with this. I think my batteries are getting low on the keyboard. Well, anyway, what is the latest? We'll go to search settings. Yeah, Wisconsin's got a confirmed case. That's the U.S.'s 11th, or sorry, 12th case now. And it's just going to keep rolling up too, right? We're going to expect that. And they have quicker testing methods now that are giving people, or giving, I guess, frontline workers a quicker way to test people for this. Search the past. Yeah, so what's this? This is be the latest updates from the cruise ship, Washington Post, coronavirus live updates. We don't really need to see that. Whoever like clicks on, like, how they conveniently place the tiniest little X, like, it's, you know what I mean? It's like the smallest X of all the X's available. And it's like, here, click on this, but there's something right beside it, and if you click on that, it's gonna take you to an ad, and you're gonna have to, yeah, it's just like, wow. Anyways, whatever, they suck. Clickbait. So, latest updates, yeah, so the official number, I guess, on, or no, where are we here? Still never got an official number of people on board. I think, actually, yes, there was. It was 3,666. And that's, I'm pretty sure. Now let's just see. Let's talk about the mainland China. Latest developments: U.S. officials have quarantined 9 people since straight travel restrictions went into effect on Sunday. I think they quarantine more people than that, actually. Well, that's just speculation, of course. We got a disclaimer, I gotta say that. Hundreds of people evacuated from Wisconsin on U.S. chartered flights will be held in quarantine on 2 military bases in California. One passenger described the scene as so disorganized after what several described as a frustrating experience in Wuhan. Well, yes, it would be a frustrating experience, I would imagine. Like, that's probably a little understating. Well, what about the other people in Wuhan? Who's coming to get them? You know what I mean? They got out, and then they're complaining, like it's disorganized. Well, I don't know if they could organize it any better, but, I'm sure the resources and the people to do all this, or volunteer, or whatever the case may be, to bring all this together and happen. And then you have them saying, well, they're complaining, oh, so disorganized. They didn't even have any in-flight movie. You know what I mean? I don't know. Maybe I'm just picking too far apart, right? Like, these guys got to come back. There's hundreds of millions of people there that are, people aren't coming for them. Jesus fuck. Why wouldn't you be happy and just shut up? Like, who cares if it was disorganized or if it was frustrating? Well, you know what I mean? You'd have no idea how disorganized and frustrating things are about to become. Forget about your weekend or Christmas holidays or whatever the hell you think that. And yes, I am speculating here again, but this thing isn't slowing down. And, you got the media being really hush about it, and that's very concerning, because anytime the media gets a hold of something, they'll run with it, right? We all know that, and they'll play it, and they'll play it, and they'll play it, and they'll play it. Like the SARS outbreak. Like, it never stopped. Like, it was 2 week nonstop coverage. Like, nothing was covered. It was like, oops, well, they didn't even have commercial breaks barely. I remember it quite vividly. And it was ridiculous. I was like, wow. And you knew they were overkilling it, right? So you just didn't worry. And I kind of was like, it's not that big. They're just fucking killing this story. And anyways, yeah, this year they're being very hush. There's almost nothing, and the World Health Organization knows nothing about it. They don't. They still say the only thing that they know is that it's being transmitted. If now they've actually said it is being spread person to person in other countries. It's BC is one of the places. A family member caught it from another family member that visited there. Who knows how many people those people infected, or could have possibly infected. We don't know anything about like the virality rate, which means like how long this thing lives. Like if it's on a surface, it just doesn't die as soon as it hits the surface. Like a doorknob or something or anything. We don't know anything about it. Nothing. And you have the world's top scientists baffled at what's going on here, and the whole world's baffled because nobody, like, you got all these media sources and all these news sources spewing all this regurgitated information about past outbreaks and past things, and I guess that is a little bit, it's not irrelevant information, but it's not so relevant in this circumstance, I don't think. We've never seen anything on this scale, on this magnitude. I knew it right from day one, and I don't want to be right, but it's like a sinking feeling. It is, and it's just the way it is. Let's hope that the rest of the world can kind of stop this, but I don't know. It's a really, really dangerous situation in China right now.
So, Daddy.
Oh, yes, buddy. Just one sec. Yeah.
Why do the China people not do that? But I do that.
Yeah, you gotta cover your mouth and wash your hands and
At least
stay healthy.
At least it can get other any other.
He listens
ones.
too much.
But some islands are safe.
Yeah, we're on an island. We're safe, kind of. We don't have anything really here yet, but it's still kind of concerning nonetheless because it's invisible and you can't see it, and you don't know. We don't know anything about it. I like my little fella said, we're on an island. And if it comes down to it, I will get some dynamite and I will blow it up. The bridge to get to the island. Like something like an I Am Legend or something. You know what I mean? They just blow up the bridge and cut everything off. But we don't know what this is. We really don't. We know it's spreading very rapidly. We know that there's a cruise ship. People are quarantined down here off the coast of Japan. And it's like, wow. And 10 people tested positive. The first 31 tests that came back, 10 people said, yeah, well, it's positive. So, that's quite disturbing numbers. Like 1/3 of the first set of tests tested positive, which is deeply concerning. But it does coincide with what the World Health Organization said about the reproductive rate of this. It's anywhere, and they gave us such a vague number. It was either not so bad or absolute disaster kind of range. They gave us a 1.3 to a 4.9, which is absolutely just mind-boggling. You couldn't imagine the infectivity that would have if it possessed those properties. Even anything above 4 is catastrophic. Just how it replicates exponentially, and especially in like populated areas where it's being passed around even more. Right? So all it takes is just to pass it around, right? And not everybody's going to get infected, maybe, but we're going to find out a lot about this cruise ship, and whether or not, you know, it's going to, if it infects like most of the people on there, we could very well assume that this is absolutely horrendous. And a third of them came back, and I'm sure they're testing everybody right now, and those tests will take time. They do have preliminary test results, but I don't think, even if all the preliminary test results, even if only like a third of them came back positive, I don't think they'd even release those numbers until like they got confirmation back, because that would really spark a lot of panic. So right now they're being very careful with releasing things, but we can't be that careful. They're trying to be like, not panic the public. They're like, oh, we can't panic the public. But that's going to be your downfall. The public should know, so we can all make a decision on this globally together. It's like, if it is what it is, then you need to tell us this. You got to come out and say, hey, this is fucking bad. And it's just a light way to put it, really. It's going to affect everyone, and everybody would have to literally come together. And they said that multiple times in the announcements from the World Health Organization. He stressed it numerous times, even in multiple reports. Like report after report, he always mentions that, and I've watched them and I've studied them. But he said it has to be done together. Here, I'll help you. Yeah, so I'm just going to cue something up here for you really quick on that. Just don't take my word for it. I will show you the facts, and if you want to know the facts on something, please don't hesitate to ask where I got my source on a particular information. I will provide it. But it's hard to go through all of them, right? And just I can only open so many windows. My computer's like, this hurts. This hurts so bad. Because I got my streaming software going, and it eats up a lot of ROM and RAM and whatever, all that. It eats up computer stuff. So, yeah, with this here. Yes, my squishy face, I will be there. Really fast. Skip ads. Right. Where are we at here? A second. Did you try closing it and opening it?
Yeah. But it's on a different color. It turned on to a different code. It not says 8.
In the rest of the world, it's small, but the situation can get worse. Let's use this window of opportunity to really invest in prevention, to invest in control, and prevent this virus from spreading. It's time to act, not to speculate and spread fear, spread panic. That's not the time. It's really time to look forward and act. That's what I would advise. And on WHO side, we will do everything to address this outbreak. But I would leave to such kind of perceptions by whoever it is for the after action review, because I don't think it helps now. Let's act and act and act. Thank you.
Maybe I could just add that John is an eminent scientist for whom we have great respect.
But it just goes on, and yeah, like stressing like the window of opportunity, and and I think it's a little different this time. And they're not saying it in so many words because they're waiting for scientific backed data before calling any major things. I think they have a good data set. You know, they're probably trying to reaffirm this, and confirm like multiple studies, and I think that's a downfall in a sense because it definitely is because it's eating up time, right? It's eating up every moment that passes by. You know, this window's getting smaller, right? And we know that the data is not coming in. Like the data could be extraordinarily big, and I think it is. I think it is, and I think they know it is, but they can only give us what's reported, right? They can only give accurate data. Remember, they can't say, well, we think there might be 10,000 dead. Well, there's 10,000, 100,000. You know, they just can't speculate and say whatever, right? You know, they can't. There was a World Health update. When was it? It was yesterday. And, you know, they said the RO value was astronomically big. And it does coincide with what's kind of happening with the cruise ship. It follows like the same kind of curve so far. Like it's a third of the people on there that they tested, and they came back positive. Well, not a third of the total people. Yeah, and there's the guest number, 2,666. I know a few, well, I don't know a few people, but there is going to be a few people who will run with that number on multiple religious outlets, I'm sure, if they ever get a hold of that. You know, like, it's, because this is going to blow up. This one here, it's not really a whole lot of attention right now. There's still more data coming in, but wait till people start dying on this ship. When they start, you know what I mean? And they are older, yes, so they are going to be more fragile in it. And this is going to really bring the world's attention to what's going on front and center. And I don't know why it's not being front and center. It's almost like hardly talked about. You know, like you think that they would be like, well, we're waiting on updates, but there's nothing. It's barely anything on the news.
Zombies versus Zach's got playing it.
Yeah, okay, well.
You'll be here for like one more minute. Be fast.
That's crazy, right?
I don't know.
You know, that's where our attention should be right now. And you know, there's 2,666 guests and 1,045 crew. It's a lot of people. But there's hundreds of millions in China, right? We gotta think about that. Thank you.
I put it upside down.
Yeah, okay. Yeah, back to this, alright. I'm a terrible streamer and I don't stream really. I have streamed video games in the past, but you know, I'm kind of like streaming this hoping that people will take a notice and maybe prepare or do something. Like, I don't know, but it's some shit show level events about to unfold. Nobody can deny that. And there's no just easy way to put that. Really.
I gave my candy to Jojo.
Okay, good job. Here you go, boy.
Me and him were sharing for a little bit, but I ate the most, but then me and him were sharing.
It's always nice to share certain things. So yeah.
And Daddy, one of my Skittles got in my lunch.
Oh my goodness.
In the soup.
Did you wipe it off?
No.
Oh, you just ate it.
No. I put it onto the table.
Oh, okay. Thanks. Not in the garbage where it's supposed to go. Alright, yeah. So, the 31 people, they tested initially and 10 people came back positive.
What? That's God playing Zombie versus.
Yes, I did have it up there. Just 1 second. We'll be back momentarily. We'll get all this settled. Stick around, please. Thanks. Yeah, if you're still here, I'm gonna start this over. Yeah, I'm gonna start another stream. It kind of went south there. I'm not a streamer, but anyway, you know what I mean. I will get this back up and running. So yeah, please, keep watching, keep up to date. There is more news coming out right now. You know what I mean. About the situation on the ship that I'm going to update everybody on. It just came out. And you know, well, it's about how everybody might have got contained in this, right? So anyway, I'll start this over very shortly. Subscribe so you can get the updates, and thanks for watching.